Good morning, folks. This is John Decker, the Director of Community Services at Alta California Regional Center. This is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. Today is March 1st, 2024, and good to see some folks here. We have a little bit of a smaller group. I know a lot of our staff are across the street at the annual CalTASH conference that's going on. I was there this morning. There's a fantastic panel of folks talking about housing and the state of housing for people with developmental disabilities in the state of California. I'll talk a little bit more about CalTASH shortly. So for today, I'm going to do introductions of our staff that we have, and then I'll go into our agenda. We have ASL interpreters on here, and so please, I will do my very best to speak in a tone that makes it easy for them to be able to keep up with in the speed. So for our staff, we have Jaslyn from Community Services and Tom and Adriana, and we have our QA and Compliance Manager, Scott, here as well. And we've got Melinda from Community Services. Good morning. And I see Rihanna on here as well, and Christine from Community Services. And let's see, we've got Carly on. Good morning, Carly, and Ethan too, and Marty. And let's see, we've got Beverly, and we've got Michael on this morning. Good morning, Michael. The only person I could see, he's tall enough, I can see him over the cubicles in our area. And let's see, we've got Marty here, and let's see, we've got Rhonda as well, our housing specialist, Gary from Community Services. We've got my assistant, Zach, who is on as well. And then we've got from our management, we've got Carol from our SLS and Deaf Services unit. We have our manager, Helen. Good morning, Helen, as well. We also have from Community Services, Leah and Denise and Shauna. Wow, we got a big group. Managers on. I see also we have, oh, look at Belinda just popped up. Hey, Belinda, I see you on there too. Belinda from Community Services. And I see Veronica from Woodland there, and Heidi, as always, from Grass Valley, who is with us. And hi there to Christina Lane as well, always holding down residential. And you guys always pop up and pop on as I'm doing this, but if I missed anyone else, we'll check in with you guys. Wave your hand. Community Services, did I miss anyone? Let me go back to the vote. Wait, Denise. Jessica's right there. Okay, Jessica's right there. Jessica Harigi, welcome as well as part of our Community Services department. She is on here. And I think I got Denise Hopkins too. I hope I did. Okay, good. All right, so for our agenda for today, actually, Garrett, I will have you kind of do the top of our agenda. So Garrett's going to present about a vendor survey. We have an update on the DSP stipend, of course, like we give you guys every week. We have an update on the assembly hearings that went on this week. We've got some updates on our the ARCA employment committee. Excuse me, not the ARCA, the DDS employment meeting, which some service providers also may have been at as well. I feel like let's see. And then the DSP collaborative job fairs, and then I'll talk a little bit about CalTASH as well, and then any other topics that folks want to go over. I did receive updates from DDS on a number of areas from the Community Services Directors meeting last week. And I heard like 200 of you showed up for the CPP, the orientation that we did last week, which is amazing. Thank you so much. We hope that we are going to get responses for all of those CPP projects. All that stuff is available on our website. So I will throw it to Garrett first. Garrett Broadbent, please.
Thanks, John. Looking forward to the other updates, especially those CSS updates from around the state. That sounds exciting. So I'm here as a representative of the Provider Advisory Committee, or the PAC. PAC, as many of you know, is a representative group of providers in this catchment, in the ACRC catchment. And we are supposed to provide guidance and technical expertise to the board. We have 3 subcommittees. We have the the legislative subcommittee, we have an outreach subcommittee, and then we have a committee that I chair, which is the vendor relations committee. Vendor Relations Committee works with mostly John and his team in Community Services, but we've also worked with Michelle and Jen with Client Services, and we're the committee that liaises with the Regional Center on figuring out how we can leverage the ways that we're collaborating now into additional things, and also improve the way that we collaborate with the regional center. We're the biggest committee, and so we get a lot of really good input, but we'd love some more input from all of you. So I put together really what should be a light lift, which is a 4-question questionnaire. There's 2 that are multiple choice, and then 2 that are just kind of open answer questions. And the questions are one about one of the resources that we put together. One of the John and our team and his team, as well as client services, we put together a couple of communication guides that I think will help a lot of providers. That's why we put them together. I think one of them is hosted on the website. That is under the current providers tab. And that has some good information on like what your community services specialist, like what they do, what you should be reaching out to community services about. And then the client services guide, is that hosted on the website, John? The client services communication guide?
John,
Sorry, I don't know if it is yet. I have not been involved in that one, but if you want me to, I can follow up with Michelle and Jennifer to see if, because it would be good if it was right in the same place, right? Right next to
Yeah.
the community
Yeah, I think
services
that would
one.
be great.
Okay.
Yeah, so we put together those communication guides because we think all of us in the collaboration, we thought that that would help streamline, like, making sure that providers are communicating with the right people on the right issues. So we want to know who's been able to access that resource, and if you haven't, that you know where to go and find it. Or maybe you're just not interested in that kind of thing. That's fine too. We also want to know what's positive about your relationship right now, because we think it's really important to build on the strengths that we already have. And then if there are areas where you've seen that things aren't working particularly well, or perhaps there's friction in the back and forth, we'd love to be able to work with the regional center on improving those things. Something we have heard mentioned several times is how much vendors have appreciated vendor fairs, and for some of the services, vendor forums. So we'd like to know who's been using those. Have they been useful? Have they not? If who hasn't, but who's interested, or if they're not interested. So yeah, please fill it out, and maybe John, we could send it out in an email to the broader community. But
Like the all service providers list for MailChimp, I think would be a good
Yeah.
one.
So please give us your input. It's important. We want it. It's going to help us in prioritizing what we do in the next year or so. Any questions about that? All right. Thanks, John. Thanks, gang.
Just as a, just kind of a continued plug for this type of way of solving and challenges that we face is that being able to have your voices out there as service providers is very important to us at the regional center. There's constantly things changing within each of your different industries also that we may not really be aware of because there's such a wide variation of different types of services. And so having that really close connection to our provider advisory committee and also really talking about how we can best support you and provide information to you as service providers again is a real interest to us. And again, I know I broadly every single week meet with everyone that wants to log into this meeting and hear updates about the regional center and what's going on, but there's also a lot of specific things that go on within your type of service that you provide where again more specific support from the regional center can always be available, but outlining what your needs are and how we can do it in a survey like this is again just very helpful to the regional center. So thanks for our provider advisory committee for putting something like this forward. And I hope that what the positive aspects that we do hear reported within the survey, we can figure out how to ensure that we have more and more people having those exact same positive experiences. So I definitely want to hear what those are so we can figure out that part of it and look at making sure that overall experiences really increase for people that are interacting with the regional center. So thank you very much for that. All right, vendor survey. And again, and I will do this every single week, but the DSP stipend numbers are back in again. for the regional centers and for this week. And so I'm going to share my screen. Hopefully, I have to do this without my email on, otherwise I get too many notifications in the middle of meetings and it gets a little bit tough. But hopefully you'll be able to see this screenshot okay. And let's see. Garrett, do we get a thumbs up? Can we see the screenshot okay? All right, so this is the February 26th update of the DSP stipend. And I don't know, you guys are getting better as service providers the farther we get into this. We are now 11% of the total weekly growth for the regional centers. I don't believe that we've got above 9 or 10% of that amount, which again just shows that you as service providers are really making this available to your DSPs. Again, I met with all the other regional centers and everyone gets these numbers and you guys are just doing an amazing job. I will still say that I believe that there are, thousands of DSPs within our area that still probably have not taken advantage of this. I know when we did our early start job fair last week, Michelle Duchesne actually set up a booth at the job fair to try to promote the DSP workforce initiatives, including the DSP stipends. For us, again, it's a big push. DDS put this together and it has not been the simplest process to get implemented, but you guys, again, as service providers are just, knocking it out. So this was our largest weekly growth that we've ever had. And the fact that this deep into it, that we still have this many new people that are joining is absolutely amazing. So I don't know if anyone has any questions about that, but I feel like every single week I getting amazing news about how awesome our service providers are doing. And I also get to share with you guys every week too. So shout out to you guys that are doing this and making sure that you've got really well-trained folks. Again, this crosses so many different service codes, so many different people are available for this, but we're talking about, growth of introduction to code of ethics, informed decision making, person-centered supports, DSPs, and HCBS final rule. Like these are all very important trainings that we want to ensure that staff are able to get. And again, we have demonstrated that our staff that are serving our local clients here are really well trained in doing this. So again, shout out to you guys. I really appreciate all the efforts that are going on. And also here at the Regional Center, we've implemented a new flyer that Michelle Duchesne made that can be sent out to all of the residential facilities. So when we have all of our service coordinators that are going out over the next 3 months and doing their quality assurance visits, they will have an opportunity to bring out a flyer as well that people can use to get signed up to do the DSP stipend. So that is the awesome news about that. Good job, service providers. Now, I want to go on to the DSP Collaborative website, and I will ask Carly to guide us through what we are looking at here. So we'll do the DSP Collaborative website, and then we'll do the employment, the statewide employment meeting for that. So do that first. All right. Am I sharing my correct screen? Yes, I am. Okay. What do we got here, Carly?
All right, so you can see at the top we have updated it now that we have passed the early start job fair. We are now advertising for our April 23rd DICE job fair. So if you click on that link, it'll take you to the news and events page, advertising our 2 flyers, one for job seekers to register and one for employers to register. We still have plenty of space for employers. I am doing targeted outreach to the vendors that we know serve that area. We really want to make sure that we have plenty of employers available to attend. We have a lot of job seekers already registered. Sutter One Stop has been a great partner. They have been advertising this. They will also be having their classes on site that day. This is right next door to their office. They're going to be just kind of shuffling their students right over to the job fair. So we should have a great turnout, and we want to make sure that we have plenty of employers waiting to meet the job seekers there as well. So again, it's on April 23rd, 10 a.m. to 2 p.m. Out in Yuba City at the Boyd Hall at Sutter One Stop. Any questions?
Whoops, I just sent the flyer that I meant to send only to this interpreter. I didn't mean to do that. All right, let's go to everyone in the meeting in the chat. Bam, there's Carly's flyer. We had an opportunity, Carly, right, this week to go to beautiful Yuba City and go check out Boyd Hall. It is a great site. They seem like they really know how to do job fairs there.
Yeah,
I know
think
it's
they've
the
done
Sierra College experience for the job fair was not the exact same as doing it in Sacramento down at the Employment Center on Lemon Hill. I think that is what our goal is going to be for this one up in Yuba City, is to have that same type of partnership. I know they're going to have a booth there as well, right?
They're
Carly,
gonna
right at the
have,
front.
yeah, they're gonna have a booth there as well. We'll also have their resource space available so that if we have job seekers come in who, maybe don't have their resume printed out or they need to fix up their resume a bit, they can go straight over to the resource center, get on the computer, print anything out that they need to print out. We will also have tables available so people can sit down, complete applications. Again, if they need to complete the application online, they can go over to the resource center and do that there.
Because we have, oh my gosh, we have 86 people on. I didn't think we'd have that many because of the conference across the street. But here we go, real quick, just for Carly's purposes. If you serve Sutter or Yuba County, would you mind just dropping your information in the chat real quick? Like I want to get a feel for, again, I did this last time with Yolo County to kind of get a feel for the group here and who serves different areas, because we, as you know, are trying not to be so Sacramento centric when it comes to the service development that we did. That's one of the reasons why I'm so happy to have Michelle Duchesne, who did not work in our Sacramento office and is more familiar with some of the service needs in that area. So Carly, just for our purposes, if you wouldn't mind just kind of taking a look at the chat, because I want to continue to promote the Sutter Yuba thing, but I also want to know what additional outreach we need to do to providers up there. We certainly have on our website, we have a service provider listing that shows the ones that are located, but for example, I think I saw Jay on there, but Jay serves that area, but his office is in Sacramento. And so it was, so it would say Sacramento on our listing. And so that's why for us, it is helpful to know. And that area is certainly growing for us. I did have a good opportunity after the Boyd Hall shares like a parking lot with our Yuba City office. So if you're familiar with where our Yuba City office is, Boyd Hall, if you stand in the front door of our Yuba City office, you can see where Boyd Hall is directly to the west of the Yuba City office across the parking lot. So it's a cool location. I'm really looking forward to it. I think we might get our HR folks up there too to try to do some recruiting, to try to hire some folks. And then we are also continuing to support our friends at Valley Mountain Regional Center. Some of you are aware they had a change in management down there. Their new executive director is actually doing the keynote speech that I'm going to miss because I'm here right now. But she's across the street doing that. Leilani that used to be at DDS is their new executive director. They're very excited about carrying on with the DSP collaborative. And I know right now they are also looking at different places, because I know many of you also work with Valley Mountain Regional Center. They're also looking for additional places to do their job fairs. But I think Carly, we talked about maybe the Folsom area or something like that after this, after we do the Yuba City one. So again, we want to, I think, strategically do these around, and it is a good opportunity for you guys to have, a job fair that's well supported by, the Sutter County One Stop.
And I think we had talked about possibly trying to get a food truck there too as well.
We know that they have, well, I didn't realize this, Carly, but apparently our clients are the ones that were in that culinary program right behind the wall behind us.
That was our client.
Yes.
Oh,
It was. And
Oh.
so, yeah, there's a culinary program that goes on in Boyd Hall. So I walked down and spoke to Jazz, our manager up there, and she said, "Oh, that's our clients are in there in that culinary program, because they switch off different days of the week." So Carly, myself, we're always looking for more partnerships, more people that we can, find ways to promote development of disability services. And so look at a good opportunity up there to increase our relationships and with the job fair. Real quickly, before we jump to the employment thing, I want to jump back over to Garrett real quick, because I think we need to be kind of close the loop on the discussion about the survey and with the survey results and where they go.
Yeah, I just put it in the chat. One of the
But
things,
did you? Okay.
yeah, I forgot to mention that this is a survey. Some surveys go out from the regional center and it's to the regional center. This is one that's hosted by us, and so the information will come directly to us to kind of digest and prioritize, and then represent to the regional center in our stuff. And so I wanted it to be clear who was going to and how we'll be using it. Thanks, John.
No problem. Yeah, it's very important. Again, if people want to not share exactly who they are and with some of their concerns, please share what your needs are. That's the important thing. Share what your needs are in a way that you are most comfortable. So again, I appreciate you providing an opportunity for that. Carly, I don't know if I have anything to share specifically on my screen about the employment, the statewide employment meeting, but let me have you go ahead and give folks an update about kind of what occurred.
Yeah, I don't have anything to screen share either, but so we had the DDS employment work group on Monday. The majority of the time was spent discussing the new coordinated career pathways service code. So that is still forthcoming. We haven't received a timeline necessarily of when that's going to be released, but that is the service code that is going to be providing the customized employment services to clients. It will also be providing some education supports and some non-customized employment supports as well. So they did share that this is going to be a time-limited service. They're looking at 18 to 24 months for this service. It is designed for individuals who are either coming out of work activity programs, exiting sub-minimum wage, or for students up to 2 years of exiting secondary education. That is who this service code is designed to support. The support staff will be referred to as, I believe it was coordinated career navigators. And so they will be ACRE or CEPS certified to provide that customized employment support. Right now, they said that they currently have all of the necessary documents to implement the service written. It's just going through their internal review. So hopefully we'll get a date for when we can start implementing this. They do have the rate, but they're not able to share that with us yet. And then they also shared information on the fiscal year data for the CIE and PIP data for fiscal year 22-23. For CIE, the data, the numbers remain pretty steady. And this is statewide data for all of the state. Statewide, the numbers were there were 1,831 CIE placements, which was pretty steady from the last year. But the PIP numbers increased by about 1,600. So right now, or in fiscal year 22-23, there were 6,134 PIPs that were done statewide. So
For the CIE, did they say anything about all of the amazing work that both you and previously Cindy did to get our numbers
they did not.
up the trajectory that they're at right now?
They did not.
Okay, I know we already shared that with this group, but again, I am beyond pleased with the competitive integrated employment numbers as it relates to our regional center, especially if you look at year over year over year growth. And so again, that's us being very active with and encouraging it with the service providers, but you guys are the ones that create a lot of these experiences and so and opportunities. So just again, we can't do it without them. Anything else that we want to touch on, Big Carly?
Those were pretty much the highlights. We also kind of discussed just where some of the employment grants are. But that was pretty much what the bulk of the meeting was discussing, the coordinated career pathways. So still forthcoming. So hopefully we can get that out and implemented soon, hopefully.
I know the Sierra College people are across the street because I just saw them at the CalTASH conference, but we're coming towards the end of our partnership with our employment grant, right, with Sierra College. And part of that is the development of some, actual, creating some items. And some of the things that we're looking at is an MOU between the regional center and Sierra College that outlines our kind of warm handoff between the regional center and Sierra that will be complemented, we hope, by the Sierra College transition. What do we call it? Transition to independent living, right? Is it, or what the life project?
Life, learning independence for future.
Life program. There we go. Life program. not the life project, the life program. So for the life program, which looks very similar to the transition to independent living program from Taft College, that has been vendored. They began interviews. I've already heard back from people that have been interviewed, and families that have been interviewed. People are so excited to get that project going. But part of that, Carly and I feel like we want more of a lasting relationship beyond the employment grant, as well. So we're kind of carving out different things. Um, Carly, could you share just real quickly about just some of the other activities? Because I know you've got the LPA event and other things that are coming up.
Yeah, so we do have an LPA summit that is being scheduled for April. I believe we settled on April 19th. So that is an idea that we wanted to
And what's an LPA again, real quick? Sorry,
our
because they love our acronyms.
local partnership agreement. So these were created from the CIE blueprint several years ago. It was an idea to get together us, Department of Rehabilitation, and local education agencies to increase collaboration, streamline our mutual services. So we still have 4 active LPAs in our catchment area. Um, I'm a member of all of them. We really just, we meet, some of them we meet quarterly, some of them we meet semi-annually, but we always have some great conversations about, what each agency is doing, what how local school districts are handling certain situations. Right now, SB 531 has been a big barrier that is a bill that is requiring any manager, supervisor, someone on site at adult or at the work experiences. So for workability and transition partnership programs have to be background checked and fingerprinted. So just kind of keeping track of what every agency is doing and how we can better support each other, how we can have better streamlined services. So but we have 4 different ones in our catchment area. So the summit in April is going to be getting all of them together to talk about how each different LPA is doing that successfully.
Thank you very much. And again, these activities, are really supported a lot by Sierra. We really appreciate that. Pride Industries has also been a partner in doing this as well, which has been nice. One of their board members has been very active with a lot of our Sierra College work. So kudos. I'm very pleased that we were able to get a vendorization done. Anything else about Sierra or
Yeah,
Carly?
another project. So Sierra College is hosting the Northern Sierra or just Northern Transition Symposium in March, and that is I think they're already sold out. They have about 150 people coming. It's an opportunity for clients, families, community partners to come to the symposium and just learn about transition services. What does that transition look like? What are adult services? So it's really geared towards, clients and their families to get that information into their hands. And so I will be presenting there, and we're looking forward to that event. It should be a great event. We're having DOR present as well. Rick Larkey with the Life Project will be presenting on the Life Project. We'll also have several other partners attending with just kind of some booths and informational handouts.
Again, there's a lot of activities that the regional center does that folks are not necessarily always aware of. And the community services department, it's important to do vendorization. It's important to do quality assurance activities. It's also very important to look for new opportunities for relationships and ways in which we can support our clients and support our service coordinators and our client services managers, because that's part of the big goal as well, is to ensure that everything functions really well. And so I appreciate all the outreach, Carly, that you're doing. I love that the DDS created employment specialist positions that can really focus on these things. And I also appreciate our community services specialists that vendor all of these resources so that, our clients can take advantage of them. So good stuff. Thank you for all of those activities with Sierra College. And it serves as an example. It serves as an example of what can go on with other regional centers, with other community colleges as well. So, and that's the goal, that they want to take this information and kind of share with others and say, hey, create better partnerships statewide. So appreciate, it's been a lot of work on both Gary and Carly's behalf with the Sierra College staff. So I appreciate you guys. All right. I want to give, I don't know what I want to give updates on next. Let's see. Let me go to the chat real quick. Make sure I didn't miss anything too major. Okay. We got the information in there for the flyers. All right. So what I want to touch on next, just real quickly, it's quickly, but I'm going to share my screen, I guess. I'm going to drop this in the chat first. First, I'm going to drop the agenda, and this is the agenda for the assembly budget hearings that occurred this week. Let's see. I'm just curious because I don't know. What I wasn't there and I wasn't able to see the crowd. If you were there or if you had like clients or staff that were there, could you drop it in the chat? I'm just curious how many of our local providers showed up, because my boss was there and she said there was a lot of you guys. That is awesome. We had the assembly hearing. I just dropped the agenda in the chat there. It went on for many, many hours on, was that Wednesday? And presentations by a number of different folks. Oh, cool. Thank you for dropping that in the chat, folks. Part of it too is I want you guys to be very involved in like these like opportunities to lend your voice at a statewide level. And I know I've been in this meeting pushing people to attend the provider advisory committee meetings, because they are really a great opportunity to have like a one-stop shop to find out what's going on, when the upcoming hearings are, etc. I believe we're looking at March 21st as our next hearing. If everyone, I believe that Jay's shaking his head, yep. And Steph has to arrange quite a bit of logistics to get folks there. I know I've been down there with On My Own as well with a ton of clients, and I heard they used, or I kind of saw that they used the small hearing room, which is a huge bummer for you guys, because that meant so many people were out in the hallway and not able to go. That being said, there was some amazing comments made by family members, regional center clients, both locally in the Alta area. We had a number of families that came, but we had people from all over the state of California talking about their services. Big push, at least for the public comment, was talking about the preservation of the implementation of the rate study and the necessity to ensure that we have sustainable rates for the future for our service providers. There was a lot of discussion as well about the flexibility of being able to have remote IPPs and the ability to be more connected if you have challenges being able to drive to a certain place or have issues with individuals possibly coming into your home. So there was a lively discussion about that as the state looks at the kind of, I think it's the sunsetting of the of some of the remote work, some of the remote IPP provisions. Again, there was a number of discussions about the rates. The Legislative Analyst Office, I know they suggested that a more targeted approach for the provider rate study be put in place, and looking at trying to get as much federal funding opportunities as possible as it relates to the rate study. But one of the challenges many of you are aware of is the status of the quality incentives and everything else. So in the agenda right there, that I put in the chat, you can read through. There's 90 pages of information about the status of the department and the budget and the financial situation. We did have DDS here last week, and I asked a lot of the questions that I've been talking to you all about for months, which is, at what point are we going to be transitioning service codes over from what people are currently vendored at to what the new service code may be if they are fully implementing the rate study. The discussions around the service provider directory, the quality incentives, it all boils down to what we also heard during the assembly hearing, which is that DDS needs to put an implementation plan in place for the rate study increase that is going to happen July 1. That's what the law says currently. The budget proposal is to delay it as it was when it was originally written for another year out, but that is not what the advocates, that's not what the families, that's not what the regional centers, that's not what ARCA is recommending. I know the Assembly Subcommittee 2 and Dr. Jackson specifically spoke about the rate study and the importance of seeing if we can, support all of our service providers moving forward. So I will just tell you, we continue to have very challenging budget projections, and we've got a lot of time between now and when the budget is going to finally come out. In the meantime, there was some things that the department is required to report on, which typically would mean that may roll down to the regional center as well. So one of the requested thing was they requested DDS to provide an alternative to the current rate delay, prioritizing the provider rates that will maximize federal matching funds. And they requested that March 22nd. They formally requested work to begin on a trailer bill for language for the master plan for developmental disability services. I went over the list, I think 2 weeks ago with you all, who I had heard was chosen by the Health and Human Services Agency to participate on that list. With housing advocates that are part of that group of folks that are the stakeholders for the upcoming master plan for disability services. And then additionally, there was a request to report back quarterly on utilization trends for social recreation, because that was a big question about the utilization of social recreation. There's been a mixed bag of responses as to how easy it is to get into your social recreation services throughout the state of California. And so they are looking for a reporting back about that. They are also looking for, let's see, they also are requesting work on existing trailer bill language related to the IPP and remote services. So there was a lot of advocates that said everything should be purely remote, provide that opportunity. Disability Rights California spoke very strongly about that. Our executive director, Lori Benalis, spoke about the benefits that she's experienced on doing in-person IPP meetings with clients, the value of their relationship building, of meeting people in person and providing opportunities for better assessments of needs for the individuals that may or may not be available through just a Zoom type of format. So it was a spirited discussion. It sounded like, the Assemblyman Jackson was interested in there being some type of compromise language as it relates to the utilization of remote services. And so we'll see remote IPPs and IFSPs. So we'll see what the update, we will see update language possibly in trailer bill or in the budget later on, or excuse me, may revise or in the budget later on. There was some self-determination updates that were given. And let's see, I'm just trying to see if there's any. There's some fiscal reporting that they're required to do as well. That probably is not too much of an interest to you all. And there was, again, a lot of public comment. Public comment consisted of a range of diverse perspectives, including a number of families who reported their loved ones have greatly benefited from regional center services. Families from ACRC, Central Valley Regional Center, Fire Northern Regional Center, Redwood Coast Regional Center, and San Diego Regional Center. And if any of you watched and had an opportunity to listen to some of those families from Redwood Coast that drove like 7 hours to get to the hearing and then stayed for like 7 hours to give their public comment, it was very powerful. And we also, I just one other thing as it relates to social rec, because I know it's been a challenge at our regional center to like fully implement it, but they really had an amazing high school student that got up there and talked about his experience being on the wrestling team and his experiences receiving social recreation services from his regional center. And certainly for us in community services, it gives us a good idea of why we do our work when it can be challenging to get some of those vendorizations done, but you have clients that talk about the real benefit to them and how it's, in their case, changed their life and allowed them to participate in more included opportunities like the high school wrestling team. So it's about as cool of a statement that you can get. Kelly Pennington from our board was on there, and her son Bradley as well. And Bradley seems to know Dr. Jackson a little bit, so that was pretty cool. They had a good interaction, and again, just very positive reports from our family members that showed up there, and certainly a lot of concerning family feedback that was brought up as well by folks that have had challenges accessing services. And so there was certainly a bit of disparity between the speakers that were brought up for public comment during the hearings, which is not necessarily uncommon. So we had the Department of Developmental Services here last week. We had Jim Knight met with the directors of community services. We had 20 out of 21 regional centers in person at the Alta office. One person was sick, and it was my neighbor from North Bay, who is the closest person. But it's a rarity to get all regional centers in one room to be able to talk about some of the challenges that we're facing and the support that we need from the Department of Developmental Services. So we were able to talk about a number of different things, and so I just kind of want to go over the highlights of the discussions and some of the concerns that we raised. So I will say we started off by basically naming the concerns that we've brought up in this meeting, which is that we do not have the complete information to fully implement the rate study. We have we do not have guidance on the service codes and how they're going to be changing. We don't know. We know that for some, we've got 92 folks on here. I'm guessing there's at least 5 probably transportation service providers. We still don't know where they landed per se with the transportation rate methodology or not. Infant development programs is another one. I don't know if we have the infant development programs that are on here, but that's another one where we are continuing to wait for further guidance. The draft that we saw back in almost a year ago of what the kind of the crosswalk was going to be, like, for example, you were vendored as an 055 community-based aid program, and your new service code is going to be this, like that type of information. What we've learned is that the department instead is going to be charging forward with their one-page descriptions of every single service code and what the regional centers are supposed to be doing with that. And the goal is that they are going to be getting that information out to us during the next month or so. And at that point, we will be implementing it as directed there. What we discussed was that, in essence, DDS has to look at 2 tracks for this, which we heard about during the assembly hearings as well. They have to prepare for what it would look like if the rate study has to get implemented on July 1, and then they also have to prepare for what it would look like if it's able to get extended out per the governor's request. It's my understanding that in the convening of the groups that are going to be working on the service code descriptions, because remember the service code descriptions is also part of the rate study that has to get done as well, which we know that there's a number of the service code that don't have the full descriptions yet, service descriptions for the rate study. So that is what we kind of expressed our concerns to be. What we asked of the department is that as they develop their plan and where they see the regional centers or the vendors having to play a role in it, that they give us as much notice as possible. Like, they let us know that, okay, in March, we're going to try to do this, April, we're going to try to do this, May, etc. The challenge is that, I just told you that now the legislature wants reports on other things right now. And so again, for us is ensuring that we get as much information as possible so that our staff can do the changes that need to happen before the end of July 1. This is one of those things where, like, the real deadline to get everything done is kind of the end of July. Like, if everything's not done by the end of July, it's going to be really tough for vendors to do that, August 1 billing for the previous month. And so that's kind of the deadline for, I feel like, for full implementation of all of these things is, in essence, right before you guys would all bill on July 1. The service provider directory, which we heard was going to be part of the 10% incentive. Some of you are familiar with that. The way the rate study works is that the final last part of the implementation of it is a quality incentive part. And it's been tough. I believe they indicated that 8 of our service codes of the 100+ service codes that we have a quality incentive measure that's been outlined. We've got some specialized, like the adult residential facilities for people with special healthcare needs, like some of those ones. But for the other ones, we don't. And for the service provider directory, we are many months delayed on getting that off the ground. It sounds like they are piloting it right now and trying to draw the data. The information for the service provider directory is coming not only from our data from the regional centers, but they're also wanting to pull information from the Secretary of State's office and draw that all into a database that service providers can update and keep accurate with their information. So I will just say right now, I don't see any heavy activities going on the development of the service provider statewide directory. I don't necessarily see how they could incorporate it into the end of the rate study. We may be on a time frame. This is me just guessing here, but we may be on a time frame where, like, in order to qualify, all you have to do is just log in, because we may not, it may not even be figured out yet what your activities have to be in order to do that. So that's one thing they're trying to outline is the statewide service provider directory, how that's going to work out. Um, the as far as the different rates, I will just say for those rates where like we're questionable, like transportation, for example, I just would not necessarily be optimistic that, and I think I said this during the transportation vendor forum this week too. I just would not necessarily be optimistic that the state is going to come up with an agreed upon new rate methodology for transportation if they have to implement the rate study by July 1. I don't foresee that there is a time frame to be able to do that. But we did have a great discussion in our meeting, which was in the meeting of the transportation providers, that getting the data and being able to provide the data through R&D allows us to show why the rate study methodology for transportation is not appropriate, why the per trip rate is not sufficient to meet the the needs of our transportation providers, and ultimately then would leave our clients in a tough spot. And so I will just say DDS heard loud and clear. I said we were in a position where we just vendored 15 new service providers for transportation in the last year, and there's still a question about what the rates are going to look like a few years from now. And so that's a concerning situation. Let's see. Additionally, from the department, we had Tiffany Andrade come and we talked about some creative ideas for utilizing some CPP and CRDP funding. We are also dealing with a lot of emergency response type of things. This would have been a good day for me to have Hubert on here, because he shared his I think it's like a blizzard warning or something that's going on for up in the mountains. But I'm sitting here in Sacramento watching the storm roll in all of the clouds out my window here. So that definitely came up as well. So I know the state is trying to look at how we can use CPP, CRDP funds also to support some of the crisis situations that go on for clients. All right. And in the chat, we have the information for the upcoming provider advisory committee. Do we have any special agenda items for that meeting, or does anyone know? Lindsay might know. Oh, wait, let me scroll down here real quick. It's always on the second Thursday of the month, no meeting in August and December. And then I know we have the legislative hearings are on March 21st. And so folks that are interested in getting together, one thing I will say is if you are planning on going and you are planning on bringing people that do not speak English, please arrange an interpreter in advance for them. It's super unfair to like have people show up to these types of things and not have interpreters available and stuff like that. Jay, I saw the ASL interpreters on the screen. I have a strong feeling that you guys made an early request, or someone did, to make sure that there was ASL interpreters there. But definitely encourage folks to give folks the ability to really communicate. That means you have to request in advance to have a interpreter for any public comments at a government meeting like that. Alrighty, let's see here. And I'm gonna go over to my calendar real quick. If let's see, events. There we go. Let me go to DDS events real quickly. So on DDS's main page, they have boom. They have their calendar up at the top. And so just upcoming things, there's the electronic visit verification. We all love our acronyms. Electronic visit verification. If you provide in-home services, there's a lot of different across a lot of different service codes. Electronic visit verification may be part of your life if you have questions about it. There's apparently a training roadshow going on. Additionally, and I don't know that I've ever seen DDS do this before, they actually put the Senate Budget Subcommittee on their website. And I think the link to be able to watch it online too. So that is really cool. They've got that information right there on DDS's website. And then on our website, I'm going to go to our menu and I'm going to go to our events and calendar. And you can see the things that we've got going on, including the across the way, lots of great, they have a big exhibit hall with a lot of exhibits set up there. So definitely recommend folks if they're interested in disability advocacy. This one is about living a self-determined life. We have an upcoming family fair. We got a UC Davis Resource Fair coming up. Haipu's got a Anime Fest coming up. And we've got our annual purchase of service data meeting. I know that Michelle Johnson talked about this, I believe, last time that this is coming up, but we do want to recommend if folks are interested in this, we do offer it. I think this one's going to be from 5 to 6 p.m. Yeah, this one's going to be from 5 to 6:30 p.m. So to provide an opportunity for people that might be working. Again, another, I say Haipu, Hmong Youth and Parents United is doing another activity. Again, they are extremely active with our clients and got case management folks on here. If you have Hmong clients and families on your caseload, please look at the different opportunities that are available for this group. Pride event through Natomas that we are supporting as well. So again, tons of great opportunities here. You can see the next upcoming Adult Day Employment Forum is on August 31st. So we've got a little while to go before that one. Let's see here. Just looking at our calendar. Oops, sorry. Just looking at our calendar, you can click on that and it gives you everything really easy to find in one place. So that is our calendar. And with that, let's see if I get anything else on my agenda. Oh, I did want to share one last thing. So on our website, they have the information. Again, we had a lot of you that were at the RFP orientation last week. I heard that the team did very well. It's the beauty of having folks that have done it many times is that they're very familiar with the presentation. But I'm going to share my screen real quickly because we did something different this year. We this time we did it on during Coffee with Community Services, and this year we recorded it. Traditionally, we've said, you know, we want you guys to all attend in person, or we do it via hybrid, but attendance is required. But that's really so we ensure that people have the information. But now it's available on YouTube, and several, well, I don't know how many hundred or more Coffee with Community Services meetings we have, but on YouTube. But that's one of them, and you can watch presentation about the different opportunities, and you can see here very clearly what some of them are as well with more detailed information. We have a variety of different stuff, not anything. The only thing I would share, which is good news, is that this project right here, the RCFE, we are actually doing that as a service code 113 negotiated rate facility. So we did not know if we were going to be able to do that. And last Friday, actually right after they did the RFP orientation, the department came back and said that it is okay for us to do that home as a specialized residential facility instead of a ARM level home, an alternative residential model home. And so we are excited about that and looking forward to people responding back to the RFPs. And I know everyone attended and everyone already has this information, but to make it even easier, I'm going to drop it right into the chat. So you've got that's the handout. I don't know why it's called June 4th, 2002, but there you go in the chat. And that is what I have on my agenda for today. Scott, I see you on there. Scott, do we have any updates that for the group that we need to know about, or Helen?
Absolutely. I can touch on our HCBS updates.
Yeah, yes.
We had a benchmark that we needed to meet by today, and that was to have 25% of all of our site visits completed, to actually have the visits completed. And I'm happy to report that we hit that mark and beat it by a little bit. We're at 26.2% today. So
well, that is awesome. So again, for us, that is the challenge, is staying on top of getting all of these done within the time frame. And Scott's been able to start his position, and he's getting staffed up, and Marty's out there running around all over our catchment area doing reviews. And they're getting done. Again, it's going to be plowing through these numbers. What's our next date where we gotta hit a benchmark?
that's a great question. I actually don't have that information.
Ooh, we're probably, I'm assuming we're a few months out, so.
I'm guessing it's quarterly.
But we'll keep you guys updated on the status of that. And I will just say every regional center is situated a little bit differently on how HCBS is going. We had a lengthy discussions about it last week statewide. I will share with you all that we are working on a statewide HCBS tool that will be a little bit easier and more understandable and maybe a little bit more person-centered than what DDS currently has through their website, the tool that was developed. And so we'll share more about that as we get more information. But again, shout out to our staff that are out there doing all of these reviews. And also shout out to our staff that are doing so many new vendorizations. We had 7 new clinical vendorizations that were done since January 1, so in 2 months. We also had 7 new care homes that were vendored during that period of time too. That is crazy. Like, to be able to have that amount of new vendors come in during that short period of time. So and knowing also that those folks are coming in HCBS compliant. That's not someone that Marty needs to go out and go conduct a review of or something like that. Those vendors already got that compliance through the vendorization and the work done by the community services specialists. So shout out to you guys. I don't see anything else in the chat. Helen, anything else? Were we doing all good?
None for me, not yet, John. The respite will be a big topic, but we're working on updating the procedures. But definitely that would be something I'd like to talk about next time.
Yes, absolutely. So let's put that down because we are on a time frame to do that, right? So
Yeah.
so we'll be presenting next week and probably next week, right, Helen?
Yeah.
Or pretty soon?
Yeah,
Okay, so we'll be talking about specifically respite, and we're going to be talking about the utilization of, is it EpiPens? Is that the discussion?
yeah,
And I guess maybe it's a discussion about EpiPens and things like that in a lot of different settings beyond just respite too. So I gotta have Carol loves this discussion, so we gotta have Carol. We gotta make sure that she's part of this one too. Carol Wilhelm. So, alrighty. Well, thank you all very much. I hope everyone has a great weekend. I'm gonna go try to run back over to the CalTASH conference and watch a few more of the presentations. And thank you again to all of you service providers and all of our staff that work so hard to support our 32,000 clients between Lanterman and Early Start and eligibility. So right on. All right, you guys have a great weekend. Take care. We'll talk to you next week. Bye, everyone.